right. And I'm going to pull up my PowerPoint here. So my name is Martha York, and I am so pleased to be invited and to be sharing this day with you. We're going to address a really important topic, and that's managing anxiety for yourself and in caring effectively for other people. So we're super glad that you're here today. And I just want to say that as a facilitator, I always welcome comments, questions, interactions. So if there's ever something that I'm presenting on that you just want to chime in, feel free to unmute yourself and ask that question or make that comment. We welcome your participation. But I'm just going to give you a little bit of an idea of what to expect here today. We're going to be talking about anxiety because it is the largest mental health concern in our country. And it helps, this presentation will hopefully help you to better recognize symptoms of anxiety and learn some strategies for yourself, as well as if you're caring for someone else who has a lot of anxiety as well. I want you to walk away from today feeling like you've got a couple of extra things to try. And this is really designed for anyone, whether it's you yourself living with the anxiety or if it's part of your work in your workplace. We just want to have a more manageable life. We want to live a life of ease and comfort. So a little bit about myself. I am a social worker of 35 plus years. I've been a medical case manager. I've facilitated, I was a memory care coordinator in a 52-bed memory care facility. I've been an activities director, a hospice social worker. And in my current role at Region 2 Area Agency on Aging, I provide workshops for people with chronic diseases to learn how to better self-manage their conditions. But personally, I like to share, especially today with this topic, that I'm a trauma survivor. I have had a stage 3 cancer diagnosis, been through a lot of treatment and surgeries as a result of that. I also survived the loss of my brother who died by suicide about 7 years ago, which was very challenging for us as a family. And he was, I'm sure, living with a lot of anxiety that he didn't know how to manage. And that was the choice that he made, which is a painful choice for all of us. I'm also a survivor of I'm part of the hashtag Me Too generation. So I live these principles. I work on this stuff. And as a result of it, I also author a devotional blog for people. It's calming words for people who have anxious, overactive minds. And it's called www.spokentomeme.com if you ever want to check that out for your own support. But I don't get any money from that. So just a disclaimer there. I want to give you a few facts and statistics here about anxiety. We know that anxiety disorders themselves are the most common mental illness in the US, and it's affecting about 40 million adults in the US ages 18 and older, and about 18% of the population every year. But anxiety disorders themselves are really treatable. However, those who are dealing with it, only 36.9, so about 37% of people who have an anxiety disorder actually receive treatment, seek out and receive treatment for that. And we know that people with anxiety are 3 to 5 times more likely to go to the doctor and 6 times more likely to be hospitalized for psychiatric disorders than people who do not have anxiety disorders. And they can develop from a complex set of factors that might include your genetics, your brain chemistry, and your personality, but it's also combined with life events that could trigger some of this for you. I sort of call it the perfect storm. If you have all of those components together, it might lead to what we call an anxiety disorder. And it's not uncommon for somebody with anxiety to also suffer from depression. So we're going to go a little bit more into all of that, but I do want to point out that anxiety is an inevitable part of life. We're all going to have anxious times, and there are situations in our everyday life that where it's appropriate and reasonable to react with some anxiety. So if we can learn how to incorporate things like exercise, good breathing skills, and relaxation techniques, managing our nutritional habits, what we're eating, paying attention to our self-talk, and starting to recognize mistaken beliefs or irrational thoughts that we might have, feelings that we have, and making sure that we work on living a more balanced life will help us be less anxious. And I think it's important to be able to recognize there is a difference between having a diagnosable anxiety disorder versus what's everyday normal anxiety. So an anxiety disorder itself is a little bit more intense, right? It might incorporate panic attacks. We're going to go into those diagnostics in just a minute. And it typically lasts longer for somebody than your anxious episode might be. For somebody with an anxiety disorder, it might be going on for months and months, or it stays even after that stressful situation has passed, or it leads to phobias that interfere with your life. And as Rebecca stated this morning already, we want to reduce the stigma around that, and to know that if you listen to this presentation today and you're like, oh my goodness, I think I might have an anxiety disorder, and you get even more anxious just thinking about that, know that that's okay. There is treatment that's out there. There are ways to support you and ways to make it manageable. I want to bring you a message of hope about that today. So here's a little sample of what an anxious personality might look like. The thing that you might see in yourself or in someone else that you know and live with or take care of might be the worrier. And this is the person who's imagining that worst case scenario. They are fearful and they're anticipating that bad things are going to happen. And they overestimate the odds of something bad or embarrassing happening. And this can also lead into what we call catastrophic thinking, just always picturing the worst. So that could be the worrier in you or in someone else. Or you may be a little bit more like me, who's got that internal critic, that internal voice is constantly judging and evaluating your behavior. And they jump on those flaws and mistakes and think that you are just failing at things. They might be really susceptible to comparison with others and feeling less than, or I can't, or I'll never be able to. And it just ignores your positive qualities, your resiliency. It overemphasizes our weaknesses when we have that internal critic sort of screaming in our ears. Or perhaps you recognize someone that we call the helpless person. They have anxiety because they always think, I'm not making enough progress, or there's something inherently wrong with me. There's a lot of obstacles that I'm never going to be able to overcome. And so they sort of complain and bemoan their situation and feel very helpless in being able to impact that. Or we could have perfectionistic characteristics. And that's very similar to that internal critic, but the perfectionist is really more concerned about always doing better. They create a lot of internal anxiety by telling themselves that what I'm doing just isn't good enough or isn't enough. I should be working harder. I should be the best. I should not make mistakes or have setbacks. And that really pushes that person to a lot of stress and exhaustion and burnout, trying to maintain this unattainable sense of perfection. Another kind of anxiety disorder is what we call generalized anxiety disorder. And that affects about 6.8 million adults every year in the US. Women are twice as likely to be affected as men. And sometimes it will co-occur with major depressive disorder as well. But how you can recognize a generalized anxiety disorder is that it's characterized by just excessive anxiety and worry. And it can be accompanied by, if it has at least 3 of the following 6 things that I'm going to talk about, then it might be what we call a generalized anxiety disorder. So it's typically that worry accompanied by restlessness, feeling very easily tired or fatigued, having difficulty concentrating. Maybe your mind goes blank, being very irritable, prone to irritability, super, annoyed by things at the turn of a dime. It might include increased muscle aches or soreness, or challenges with sleeping, where you might have trouble falling asleep or staying asleep, or you just really have restless and unsatisfying sleep. When someone has a generalized anxiety disorder, it may include panic attacks or being afraid of being embarrassed in public, or being fearful of being away from home or close relatives, like a separation anxiety. It doesn't have to include those things, but it might. And it might also include some physical or somatic complaints or symptoms like muscle aches, trembling, twitching. It might include feeling kind of shaky, having muscle aches and soreness. A lot of times I think we, clench our shoulders or our jaw and we get headaches and a lot of tension that way. It may also include sweating or nausea, diarrhea, or an exaggerated startle response where somebody moves and you jump out of your seat. This may also have symptoms of hyperarousal that includes an accelerated heart rate, so feeling a racing heartbeat, shortness of breath, dizziness. And for a lot of people with a generalized anxiety disorder or a panic disorder, it really mimics a heart attack. Many people think I'm having a heart attack because of all those hyperarousal symptoms. Oftentimes, depressive symptoms are common. They accompany that anxiety disorder. So it may be diagnosed as a depressive disorder, but it could actually have features of generalized anxiety disorder as well. And just that racing thoughts, your mind's always spinning. Another kind of disorder that is associated with anxiety is what we call panic disorder. And that too affects about 6 million adults in the US population. And again, I don't know why, but women are twice as likely to be affected as men. So in order to get a diagnosis of panic disorder, which is really characterized by a sudden episode of acute apprehension or an intense fear that kind of comes out of the blue, oftentimes without an apparent cause. And when you're having a panic disorder, it typically will last a couple of minutes, but it could return in waves and last for as long as 2 hours for some people. Symptoms of a panic attack include having chest pain or discomfort, chills, hot flashes, excessive sweating. Maybe they're just terrified that I'm dying or I'm losing control or I'm going crazy, just this excessive fear of that. Feeling dizzy, unsteady, lightheaded, or faint. Feeling like sort of detached from yourself, like it feels sort of surreal. Having those heart palpitations, a pounding heart or an accelerated heart rate. Having nausea or abdominal distress. Experiencing numbing or tingling sensations. Shortness of breath. A lot of times people with a panic disorder might describe feeling like they're smothering or that they're choking, and having trembling or shaking. If the person is experiencing 4 or more of those symptoms, it's what we call a full-blown panic attack. And if they're experiencing just 2 or 3, it's still a panic attack, but it would be what we call a limited symptom attack. Another kind of social or anxiety disorder is what we call social anxiety disorder, and that affects about 15 million adults. So that's more than twice of what we just described with the panic disorder and generalized anxiety disorder. Social anxiety disorder is when we are experiencing some physical symptoms, basically surrounded around worry about meeting people. The person with a social anxiety disorder is afraid of being observed, being seen, having to perform in front of other people, and they'll exhibit some real severe avoidance, like I'm going to do everything I can to get out of that room or out of that situation. Interestingly, it starts to show around age 13, but a lot of people, that's part of that anxious state of being in our teenage years, and they might not, even though they're experiencing those symptoms, they might not experience help or seek help for about 10 years. So it's not until they're in their early to mid 20s that somebody may say, gosh, I really have a hard time with this. It's important, though, before we diagnose somebody with an anxiety disorder, that we rule out other possible medical causes that also appear with anxious symptoms. So somebody with early Alzheimer's disease may exhibit symptoms of anxiety. When somebody has a cardiac arrhythmia, so their heart isn't beating regularly, that can produce anxious symptoms. Having hypoglycemia, so low blood sugars, so people with diabetes or people with prediabetes or anybody who is experiencing hypoglycemia can also get shaky, get nervous, get some of the panic that goes along with an anxiety disorder. Someone with Parkinson's disease also may exhibit anxious symptoms. Having a seizure disorder can produce anxiety. And then we've got the thyroid dysfunction. So if your thyroid's a little bit off balance or you have Graves' disease, that can have that shakiness, that nervousness, that panicky sense that goes along with anxiety. Having vertigo, experiencing acute hypoxia. So you're getting this respiratory thing going on, respiratory acidosis. People with lupus, people with fibromyalgia, they experience anxious symptoms as well. Or someone with irritable bowel syndrome. Gosh, they're always nervous about when am I going to have a flare up and how am I going to manage that? And it can produce anxious symptoms as well. People with sleep apnea often will exhibit anxious symptoms, as do people with cardiopulmonary diseases. When they can't breathe very effectively, that can produce panic when you've got those pulmonary issues going on. Or people with chronic pain, right? It doesn't take much to trigger an episode of anxiety or panic when they're dealing with this chronically and their body is taxed by that. So when you might have a medical condition like that, it's really important that you're doing what you can to manage that get that diagnosed and manage that medical condition. And that may reduce the anxious symptoms that somebody is experiencing. So you want to rule those out first and do whatever you can to address those. We also know that certain medications contribute to anxiety. So if somebody is taking an anti-inflammatory agent, that's your NSAIDs, like your Advil, your ibuprofen, Aleve. Antihypertensives, atenolol, can trigger anxious symptoms. Hormonal therapy, people who are taking birth control or who are on Premarin may experience anxious symptoms. People on anti-Parkinsonian medications or thyroid medications themselves, if they're not at the right dose or they have an extreme side effect, it could produce anxiety. Bronchodilators, so people who are taking those inhalers like albuterol, Atrovent, Accuvent, those can produce anxious symptoms, shakiness, nervousness. Hypoglycemics like glucophage and antihistamines, even Benadryl, Claritin can produce anxiety type symptoms. So knowing that, rather than thinking, oh my gosh, I might have a full-blown anxiety disorder, it could be that you're on some medications that are just elevating those anxious symptoms. So keep that in mind. I want to bring up next that there was a survey done with older adults in Michigan about their isolation during 2020, and they noted that almost half of older adults reported having infrequent contact with family, friends, and neighbors. So we know during this pandemic, there was a lot of social isolation, and that insufficient social contact or social support can lead to anxiety in other ways. And look at that figure on the bottom, 31.2% of older adults reported having insufficient social contact in more than one or more of these areas. And we know that loneliness can trigger all sorts of health risks now. They've been studying it, and they say the magnitude of loneliness and social isolation can have a similar impact on your body equal to smoking 15 cigarettes a day. So it limits our longevity. It affects our mortality. And one of those things that comes out of that chronic loneliness or social isolation can be anxiety and anxiety disorders. That absence of social engagement really affects our coping strategies. Without that regular connection, we know that people's physical and mental health have been severely affected. We've seen it, and I don't know about you, but I've experienced myself that increase in anxiety during this pandemic because we're not reaching out to and connecting with others the way that we normally do that helps us cope. So during this pandemic, especially older adults have been nervous about reconnecting with other people. And I know that that's happening for a lot of us right now, like to mask or not to mask. Even though the CDC might change their regulations, we still see a lot of people concerned about going out in public, going to the grocery store, joining those social activities. We've got some social anxiety that might have developed during the pandemic that you've never experienced before in your life or the person that you're caring for. It may be a new thing that's surfaced. And here's another thing that's really important to notice, that unpaid or even paid caregivers are at higher risk for loneliness and for social isolation, because just the nature itself, the restrictions of caregiving and the time constraints of being attentive to someone else and carving into or cutting into your time for your own good self-care, we know that caregivers are experiencing more anxiety, more loneliness, more social isolation. And especially if you're caring for someone with Alzheimer's disease or another kind of cognitive decline, that's a unique kind of social isolation, because even though you're spending a lot of time with another person, that relationship really might not be reciprocal. It's not a two-way street. And so it has a different level of stress and unhealthiness when that's the person that we're around most of the day. We also know that trauma, if someone has experienced trauma, that leaves a person feeling hopeless or helpless and triggers a lot of anxiety for people. So I want to briefly touch on ACEs. You've heard them talked about. You might have attended webinars and trainings on them, but if you're not familiar with them, I just want to point out that they've been studying that people who experience adverse childhood experiences have an increased risk for anxiety and anxiety disorders. So an adverse childhood experience could include that they witnessed domestic violence or substance abuse in the home, that they were exposed to emotional or sexual abuse themselves. If they lived with a mother or father who had severe depression, that could be an ACE experience. If they experienced physical or emotional neglect, were a child of divorce, lived in a home where there was mental illness, or that they had a parent who was incarcerated, or they ever had to go through a period of homelessness as a family. If they experience poverty or discrimination, or just that lack of opportunity for positive community supports being in their life to help them get through these experiences, if they witness any sort of violence, any of these things combined might impact someone's ability to cope. And we're going to go into that a little bit further. So coping would be what we call resilience. And that's that ability to be able to advance or to move forward despite the adversity that you're going through, and having that capacity to meet your own needs. So the principles of resiliency really are having some autonomy or some control over our own choices and feeling that sense of, I have some say here. Also experiencing a sense of belonging. Rebecca mentioned earlier about the importance of connection for people who have been through addictions and people who've been through ACEs. They need to have a sense of belonging where they're interacting with and connected to caring adults, other people who are valuing them and giving them a sense of support. A resiliency also can be developed by having a sense of competence, feeling like I can do what it takes to effectively interact with my environment or to get things done in my life. I have some capability here. So examples of individual resilience are, maybe you have the income necessary to pay your bills. That feels pretty darn good, and that's a resilient state. Or maybe you have the mental capacity to perform tasks that are in front of you. That gives us a sense of self-esteem and self-worth and resilience. Perhaps just knowing how to navigate the systems that you're living in. That can be an example of, I'm a resilient person. But we also sometimes need family or community relationships with a supportive network to help us be able to accomplish things, even when we might not be able to do it completely on our own. So some examples of community resilience are that maybe your next door neighbor shovels the driveway for you because they know it's hard for you to do that. Or you have a good friend who delivers a home cooked meal after you gave birth to your child. Perhaps you had to reach out to a local organization for help with utility bills when we had a really cold winter and the bills were higher than you expected to be able to pay on your own. So that's examples of how our community can support someone and build some resilience for them or in partnership with them. So what you see here on the right is a diagram of what we call the resilience zone, or in other words, the OK zone. That's that little red squiggly line in the middle. When somebody's in their resilient zone, they might have a full range of emotions going on, but they feel like they can do well to manage their own thoughts and their feelings. When you bump out of that resilience zone on the top part here, a hyper aroused state would be when you feel really anxious. You might feel super overwhelmed or a little bit out of control. Or maybe you've got anger that's triggered. You're in rage, you're hot. Like this anxious zone on the top is when we bumped out of that okay zone. Or we can be bumped out of that okay zone into what we call a hypo aroused state, which is when we're sort of numbed out, maybe spacey, zoned out, a little bit cold, or you see someone in a state of depression. Traumatic experiences, or those ACEs as a child, or traumatic experiences as an adult, can narrow our resilience zone. And somebody with a narrow resilience zone is just going to be more likely to get bumped out into either that hyperarousal or hypoarousal state. And so what we want to do is help people develop resiliency skills, kind of like what you're doing today, attending this webinar. When we use regular practices of exercise or mindfulness, it can actually widen our resilience zone. Somebody with a wide resilience zone can have traumatic or challenging experiences, but they're going to be less likely to get bumped out into one of those other states. And they're going to feel more capable of responding and managing, and maybe even using good problem solving skills or creative solutions to get through a difficult situation. They're more equipped. So we're going to look at some strategies to equip you in managing anxiety for yourself or for somebody that you're taking care of. We know that one of the very best things that you can do is incorporating good physical activity into your day. And they suggest about 30 minutes total, but the good news is that doesn't have to all be at once. If you're someone who's like, I hate exercise, it gives me a rash even thinking about it, you can be physically active and do it in 5-minute increments or 10-minute increments. And it might be, for some people, it might be the challenge of getting out and going to the grocery store and walking around the store for 15 minutes. There's 15 minutes of your physical activity. Or go into the mailbox and back. Or it could be some chair exercises that you do while watching a favorite program on TV, where you're lifting some weights or swinging your legs around while you're seated. The idea is just to get 30 minutes of activity in there, and it's going to help bump that anxiety out the window. Truly one of the best things you can do for yourself. So you want to develop a regimen that includes stretching and strengthening and aerobic activity. And if you're like, I'm not doing any of those things, then pick one. Maybe it just starts with a little bit of stretching. Okay, that could be something that really relaxes your muscles and helps you to deep breathe and get through an anxious state a little bit more quickly and effectively. Another thing that we can do for ourselves, and we have control over what we put into our mouths, is eating a well-balanced meal. And they suggest 3 well-balanced meals, but for some people, it could be that I eat not a giant meal, but I eat 6 small meals during the day. But the idea here is to make sure that it's healthy, that it includes nutritious foods. And we do strongly suggest that you don't skip breakfast, because you need to bump that metabolism into gear with a good breakfast in the morning. It's important also to stay well hydrated, to be drinking your water, and to remind yourself to do that. Maybe you need little reminders on your phone, or a little app that just gives you a bell that says, okay, it's time to take a sip of water. Plant-based diets are shown to be more effective with helping people manage their overall health. And when you've got good overall health, that decreases your anxiety. Trust me on that. You might also want to consider limiting your caffeine, because caffeine jolts us up and it gives us extra stress sometimes. So limit the amounts of caffeine, limit the amounts of alcohol too, because alcohol can be a depressant. And when we are turning to alcohol to try to calm our nerves or to get through a stressful situation, it might actually end up causing more stress over time, because it leads to more depression and maybe impairs our decision making. So limit your use of that. Another thing you can do that might be to start with a stress awareness diary, where you just kind of jot down when you notice you've been through sort of a stressful event. And what were some symptoms around that? What did it look like to you? Did your face get flushed? Did your hands start to shake? Were you sweating? Were you thinking, I got to run out the door? Like what is it that made you aware that you were going through this experience? And then from that stress awareness diary, starting to recognize what triggers us and what's going on for us, what's some problem solving that we can do to help us get through that situation the next time? Maybe we practice slowing ourselves down, not racing physically. Mindfulness to slow down those racing thoughts. I'm going to teach you some of those in just a moment. Perhaps you might want to use meditation and visualization exercises like imagining that you're walking down a peaceful country road and you just give yourself a break for 5 minutes at your desk or in your day where you just kind of float away for a second and imagine a peaceful space for you. Maybe it's on a beach, maybe it's in a favorite cozy room with a bunch of fluffy pillows. I don't know, but you just want to picture yourself in that space and relaxing. And it does physically calm us down to do that kind of visualization. You might also want to consider carving out and committing to some downtime. For me, I even plug it right in on my Microsoft calendar, right? I put in times for focus or times for downtime so that because I tend to be an overachiever and I go all day long. If I don't put it on my calendar, I won't commit to it and I won't carve that time out for myself. So maybe you could just start putting it on your calendar as a daily reminder. We also want to work on recognizing our irrational ideas and our catastrophic thinking. Once you start to pay attention to it, you might be surprised at how often it's flaring up. But awfulizing is one of those kinds of thoughts that are irrational. It's when we get these real catastrophic or exaggerated interpretations of what's going on around us. So, for example, you get a momentary chest pain and that suddenly escalates to, oh my God, I'm having a heart attack. Or your boss or a coworker passes by you and they look a little bit grumpy. They've got a frown on their face and you're thinking, oh my God, they're mad at me. I've done something wrong and they're so angry with me. I'm going to get fired. Like it just escalates into these irrational, awful thoughts that probably aren't accurate. You might also want to work on recognizing if you are one of those absolutists where you include a lot of words like I should, or I must, or I ought to, or gosh, I always do this, or I never do that. These are absolutes, right? The idea that you have to have things a certain way and any deviation from that standard is considered bad. You might be an awfulizer or you might be an absolutizer. But this is when you're absolutizing, that means that you're always leaving that expectation bar up way too high. And not allowing yourself the grace to recognize that nobody lives up to that standard. Typically, these are just irrational beliefs for ourselves or irrational expectations for ourselves. So you might want to practice moving that expectation bar down low to something that you know you can attain and giving yourself a little bit of wiggle room for flaws and errors that are beautiful things that are part of your personality too. Albert Ellis had a wonderful list of irrational beliefs. I'm going to highlight a few of them here, but here's an example of something. And if you're like, wow, that's me, you might want to jot that one down and think about paying attention to how often that triggers in your mind. So if you're someone who thinks, gosh, I have to have total love and approval from my peers and my family and my friends, and if I don't have that, then I'm not a good enough person. Right? Or I must be unfailingly competent and almost perfect in all I undertake. That expectation bar is way too high. Or you feel like, gosh, I've got to do everything to make sure that situation turns out well. I want to make sure I create happiness for me or for someone else, or I'm going to avoid sorrow by controlling. There are so many things that we can't control, but we especially can't control the happiness or well-being of someone else. That's not up to us to manage. Or if we think, gosh, somebody is disapproving of me, then I'm just a bad person. Being fearful of judgment of others, or thinking that your worth depends on how much you achieve or what other people are thinking of you all the time. Or criticizing yourself inside whenever you get a little bit irritated or angry, thinking that that's bad. Anger is a normal feeling, and there are situations that are reasonable to feel frustrated and angry in unjust situations. So if we can recognize those awfulizing types of thoughts, Or maybe pay attention to these catastrophic thoughts so that we can start to address them and do some thought replacement. It's helpful. So take a look at this list. Some catastrophic thoughts might be, oh, just fearing I'm going to die, or I'm going insane, I'm losing control, or maybe just really feeling scared all the time, thinking, oh my gosh, I'm having a heart attack, or I'm going to pass out, or I'm not going to be able to breathe. Something terrible is going to happen. I'm going to make a scene here. Okay, you get the idea. Maybe you're one of those worries that think people are going to think you're going crazy, or you already are there. Being afraid of acting foolish, or, I've had cancer. So it's very easy for me to have a little somatic symptom and all of a sudden, boom, I think, oh my gosh, my cancer's back, and it's spread and it's here and it's there. So just, getting an elevated response, this catastrophic response is what we want to pay attention to. Thinking that you're going blind. I have a funny story about my cousin, although it was not funny to her at the time, but it was during an eclipse. She called up her husband and she was in an absolute panic. I'm going blind, I'm going blind. And it was actually just that the sun was passing behind the moon for a couple of minutes on that day. But we get those kind of exaggerated thoughts and they feel very real to us. Okay, I get that. I'm not minimizing that or making a joke of that. So if you get these kind of paralyzing thoughts that you're going to babble or talk funny, or that there's something really physically wrong with you and you're prone to that, it might be that we've got to work on some strategies to manage those catastrophic thoughts when they come up. But also, first of all, to recognize that that's what's happening. I'm catastrophizing or awfulizing here. So when that's happening, when you've done a stressful thoughts inventory about, do I awfulize, do I absolutize, do I I can't think of the word for that. Do I make things catastrophic? Check with yourself and say, now, is this really realistic or is it unrealistic? Am I exhibiting some pretty self-defeating thought patterns here? Is this rational or is it maybe a little bit blown out of proportion? Okay. So do that stressful thoughts inventory, ask yourself those questions, maybe even write these things down, go back later and journal a little bit about that stuff. And then work on some thought stopping and thought replacement strategies. These work, okay? So what you do for thought stopping is you concentrate first on that unwanted thought, that thing that's racing around in your head. Concentrate for a little bit on it and then tell it to stop. Interrupt that unpleasant thought. Maybe for some people we teach, like, pinch your middle finger and your thumb together and squeeze them for a second until that thought just stops. Just say stop. Or maybe you might want to put a rubber band on your wrist and snap it. Don't hurt yourself, but just do it lightly, just as an intentional reinforcement of that thought stopping. Okay. Or another thing that you could do is, when you recognize I've got those irrational thoughts, substitute those with another more rational or positive statement, like, everything's as it should be. I am good enough just the way I am. I made a mistake, but it's okay. What's going to be the thought replacement? I am good. Things are well. I am capable. I'll get through this. Start doing some good reinforcing with positive thinking here. If you know, or you're dealing with someone else who has a lot of anxiety, you might want to ask them some of these questions. First of all, ask them, well, what do you think is the worst thing that could happen here? And listen to that. Listen to that without judgment. Just very softly nod your head and take it in. What do they think is the worst thing that could happen? Don't judge it, or don't tell them, no, that's not going to happen. Just listen to it. And then ask, well, what do you think could be the best thing that could happen? What's the best case scenario? So just get them to just kind of encourage them to think maybe there could be a different outcome here. And after you've talked about those two things, then ask them, don't tell them, ask them, what do you think is the most realistic thing that's going to happen here? The worst thing or the best thing, or something in between? What's most likely? And then offer them support, no matter how they answer. If they think, nope, only the worst thing's going to happen, then just support them and say, that must be really scary for you, or that must be really hard for you. And I'm here for you. I just want you to know I care. Okay. Support them, but don't take over. Don't fix it. Don't problem solve it for them. You want to empower them with just validating their experience first and foremost. That sometimes is just enough to help them get through an episode. But another great technique is deep breathing. In fact, I'm going to ask you to do some deep breathing with me right now. What you want to do when you're deep breathing, I'm going to explain it first, is you breathe in through your nose all the way down to your belly, your abdomen. And you want to do this very slowly to a count of like 3 or 4 in your head. And when you go to so you're inhaling and kind of like inflating your stomach like a soccer ball. And then when you go to exhale, it's like you're squishing the air out of that soccer ball, but you want to do it nice and slow through pursed lips, and you double the amount of time it takes to exhale. So let's practice that first step together. Let's take a big breath in and exhale. Beautiful. Let's do that again. Big breath in and exhale. If you feel a little bit dizzy or lightheaded, it might be that you're exhaling a little too forcibly. So just keep it up. Just do it nice and gently. Again, a big breath in and exhale. And as you're exhaling, you might want to silently say things to yourself like relax, or let go, or be calm. Just saying that word alone eventually might even be able to bring on a mild state of relaxation for you when you practice this regularly. And this calming breath exercise can be a great technique that's just going to stop a momentary panic reaction. It might stop it earlier so it doesn't get so full blown. Or if you notice the early signs of anxiety that are coming on, that's a great time to practice some deep breathing. Just stop. Let's take a big breath. Exhale. And concentrating on our breathing like that and on counting 1, 2, 3, 1, 2, 3, 4, 5, 6. Concentrating like that's going to help you also stop that racing thought that's going on. So deep breathing and concentrating on the counting can be a wonderful technique. Along with deep breathing, there's another strategy called progressive muscle relaxation. Boy, oh boy, is this a treat to do for yourself. I'm going to give you a real abbreviated version. I'm going to invite you to do this along with me today, but I encourage you to go back and practice this at the time frame that's recommended, which is more like taking 20 minutes to do this. We don't have that kind of time right this morning. But what it is you're tensing and releasing various muscle groups throughout the body to produce a deep state of relaxation. And we know that using progressive muscle relaxation can help stop a panic attack. It can reduce generalized anxiety and anticipatory anxiety when you think you're going to be going through a rough situation, or when you're dealing with a phobia. These kinds of techniques, strategies really work to help you get through that moment. But regular practice of these can also improve your concentration. It can give you a sense of control over your moods. And trust me, I practice this stuff. It works. It can increase your self-esteem and increase your sense of spontaneity and creativity because it frees up our mind to allow those good things to be happening. So again, they suggest you do it for 20 minutes a day. It's more suggested that you find a quiet location. And then if you're able to lie down, that would be the best posture to have. But for me right now, I'm just gonna put my feet flat on the ground and sit with a nice tall back. And also try to not judge your performance here. Just relax and let it happen and not say, am I doing this right? Okay. So you're going to tense each muscle group for a few seconds without straining. And then you're going to release it kind of rapidly and allow that sense of calm and relaxation to come into play. So I encourage you, don't think it's weird. Try it along with me. Let's start with a couple of big abdominal breaths. Big breath in. Exhale. Again, big breath in. Exhale. I'm going to encourage you to put your arms straight down and make a big, tight fist. Just straighten your arms as tight as you can. Clench that fist, squeeze it tight, 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 tight for a few seconds. Tight, 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 and then let go and let them fall limp. Take a big breath in. Relax. Next, let's tighten your biceps. Draw them in up tight, like towards your shoulders, like you're making a muscle with both your arms. Hold it, squeeze it, squeeze it, squeeze it. Squeeze a little bit more. And then let them fall limp again. Big breath in. Relax. Now we're going to tighten our triceps. I want you to straighten your arms and kind of push them back behind you. So you're tightening that whole arm from the fist all the way up to your shoulders, squeezing those shoulder blades a little bit together. Squeeze it, squeeze it, squeeze it. And then let go and relax. They should feel nice and tingly right now. Take that big breath in and release. Now I want you to tighten the muscles in your forehead by just raising your eyebrows as wide, as high as you can. Open your eyes wide. Make those eyebrows go way up. And then relax. And feel that deep relaxation spreading all around your eyes and your forehead. Next, I want you to open your mouth as wide as you can and stretch those inner hinges of your jaw. Let your lips fall apart. Just open your jaw loose and open as wide as you can. Hold it nice and wide. Hold it, hold it, hold it. And then relax. Good job. Big breath in. Release. Now let's tighten the muscles in the back of your neck. I want you to pull your head way back, lean a little bit gently back. If you can do it without hurting your neck, don't injure yourself, but just hold it back. Squeeze it a little bit towards your shoulders. Squeeze it, squeeze it. Oh my gosh, we carry a lot of tension there. Okay, now let those shoulders just fall limp and shake it out. Take a big breath in. Relax. Now I want you to tighten those shoulders up. I want you to raise them up towards your ears. Squeeze those shoulders up, squeeze it, squeeze it, squeeze it like a turtle going in its shell. Pull them up tighter if you can, a little bit higher. Higher. It's probably burning. Okay, go ahead and let them down. Let it relax. Ooh, that feels good. Big breath in. Release. Next, I want you to pull those shoulder blades together in the back of your body. Just kind of like pull your elbows together, like you're squeezing them back behind you. Hold it, hold it, hold it a little bit tighter. And then relax. Let it fall down, nice and easy. Big breath in. Exhale. Let's go for our stomach next. I want you to suck that stomach in really hard, like it was hit with that soccer ball. Just suck it in. Squeeze it, squeeze it, squeeze it. You might feel it all the way around to the back. That's okay. That's all our midriff. It's good. Squeeze it. Now, let it relax. Big breath in. Release. Next, let's squeeze those muscles in our thighs and our buttocks. We're going to do both of them together. I want you to lift yourself off that seat a little bit higher. Squeeze it, squeeze it, squeeze it. Pull it up. A little bit tighter. You might be shaking. It's okay. And then relax. Let it down. That gets all the way into your hips and your thighs. So just picture those thighs smoothing out right now, relaxing completely. We're going to move to our calf muscles next. I want you to pull your toes up towards the ceiling, pull them up high, so your ankles are bending. Flex it if you need to avoid cramps. Good, now set that foot down. Take a big breath in. Release. And now let's curl your toes downward. Maybe lift your heels off the ground. So this time your toes are pushing into the floor, but your heels are up. So your calves are really tight. That way, squeeze it, hold it tight. A little bit longer, a little bit longer. Good. Okay, go ahead and set those down. Take a big breath in and release. Now, mentally, just kind of scan your body for any residual tension from the top of your head all the way down to your feet. And if you need to repeat one or two of those relaxation cycles, go ahead and address that muscle group now. A similar technique to that progressive muscle relaxation is what I like to call the grounding technique. I use this one all the time, especially when I'm trying to relax and fall asleep at night in bed. But the idea is you're moving from the ground up, doing that exact same thing that you just did. So you start with the surface underneath your feet, you tense and release your feet, then you move up. So to your calves, to your thighs, to your buttocks, to your belly, to your hands and arms, to your shoulders and neck, and to the top of your head and your face. Okay, so you move from the floor up, focusing on those same tensing and releasing kinds of practices. This is a very helpful technique to help somebody move out of a panic attack. I like to have them even describe what it feels like underneath their feet on the floor or underneath their bottom on the chair. What does it feel like? Is it hot? Is it cold? Is it tingly? And it gets them out of that spinning, racing thought pattern into more of a somatic recognition of what's going on in our body. So it can be very, very helpful. Some alternative therapies you can try to manage anxiety that work great are doing things like music, turning on a good song or something that it can change your mood in an instant. So using music with activities is important. Considering doing some art therapy. For me, journaling is an essential daily practice, just like eating and getting up and getting dressed is. I have to journal every morning to help focus my thoughts and prepare myself with a positive outlook for the day. And it's essential, and it's made my anxiety go from here down to here. And I love that practice. So maybe you might want to consider journaling, writing down your thoughts and feelings. Pet therapy, they do great things for us with that unconditional love. So spending time with pets or treating yourself to a massage, that can be a wonderful way to release some deeply tense muscles and really helping your body get the kindness that it needs. So consider some of these alternative therapies, but always know that it's helpful and a-okay to seek counseling. Whether you think you have an official anxiety disorder or not, counseling is a great treat to help anybody address that negative thinking process. Or if you have challenges with your self-worth, or if you find that you worry a lot about other people's perceptions of you, this is a great way to address your anxious habits. And it can be one of the best gifts you ever give to yourself. I highly recommend counseling. You might want to look at ways to increase your social connectivity, reaching out to other people, whether that's using phones by texting or Facebook and FaceTiming. I don't care what your social media preference is, just get connected to other people and increase your engagement in social groups. If you're worried about doing that during a pandemic, online communication is just as effective and is a great way to still connect to others. Think about taking a workshop. I offer a lot of workshops for people, and anxiety is many times their key symptom that they're trying to manage. So think about online support groups or in person now that they're starting to open up again. And consider telehealth if you need to. If you're reluctant to go see the doctor, maybe a telehealth appointment would work well for you. And that's great. Reach out and connect, get that counseling, get that healthcare, get that socialization. You might want to think about creating an anxiety toolbox. And in that toolbox, you can put things like a crisis line number or numbers for support people in your life that you want to contact. Because sometimes when we're in the heat of the moment, that's when we don't think of what we can do. So have that box handy to reach to and put things in it like I've got this nice thing from the former Substance Abuse Prevention Coalition, now called Drug Free Jackson, right? A little hand squeezer there. Or maybe you want a koosh ball or a smooth rock. I keep little worry stones here at my desk that if I'm going through a stressful time, I can fidget with that, okay? Maybe some calming CDs can be in that box. Or I now use a sound machine. It has ocean waves on it, and I sleep like a baby when I put that thing on. So think about getting a sound machine for yourself. Use coloring books, adult coloring books and crayons. Get lost in that art and that creativity. Put that in your box. Or a coping card with some of the strategies we talked about today, thinking like, I'm going to incorporate physical activity. So I'm going to go for a walk for 30 minutes or 15 minutes, or I'm going to do that grounding technique that we just practiced. Make a tip sheet for yourself of some strategies that you can try. Keep your journal in that box, a place to write down your private thoughts that nobody else gets to see. Or if you're nervous about journaling and you don't want other people to read it, I always say you can always write it on toilet paper and flush away the evidence. But the idea is just to write it down and get those thoughts out of your head onto the paper where you can get better perspective. Put some sample affirmations in that anxiety toolbox. I have all sorts of little affirmations, little sticky notes that I put on my computer or my mirror in the bathroom or on my dashboard in the car. Just little affirmations reassuring me that I can get through this and I'm capable and competent and I got good things going on. So develop a plan for yourself, please. Think of ways to stay in regular touch with the people that you know who are having difficulty with anxiety, or for yourself if it's you that has difficulty. That video chatting can be done without an in-person contact, and it's a great way to just manage being in touch with others that might be able to also continue to support your wellness. Use your community resources, Lifeways, faith-based communities, our organization, Area Agency on Aging. We even have a friendly reassurance program that calls people once a week who are very lonely and isolated. So if you know somebody who could use that, refer them to our program. There are lots of resources out there for counseling, for food, financial assistance, housing, supplies that you might need. We don't have to worry about these things. There are things in the community that can help us. I use apps on my phone too. I have a wonderful one called I Am, and that reinforces positive self-talk for me. You can program it as to how many times a day you want it to shoot a nice positive self-talk message at you. And I can't believe how much that has changed my mental habits. It's like a laundry machine for my negative thoughts. I get to right away replace them with some rational and positive beliefs. So you might want to think about looking that one up. Or the Insight Timer is another great one that has guided meditations and prompts to help you with better self-care. So use these tools that are out there on the internet. And please, let's talk about being anxious. Let's make it our everyday norm that is part of our conversation without stigma. It's very, very important that we all admit to, I struggle with this, right? But I'm not a weirdo. I'm not positive enough, not prayerful enough, not hopeful enough. I just have some anxiety, right? So let's normalize it, and let's make sure that we reassure people that are going through a significant period of anxiety that you know that your perception of them hasn't changed. They're still the same person. They're just suffering a temporary problem that might feel a little bit out of control, but you still love them. They're not broken. Who they are hasn't changed. And to the extent possible, help them to stay connected to positive aspects of their identity. Encourage them to see themselves in a different way and to participate in things that are of interest to them, hobbies that they used to do, things that they're good at. Help them to get encouraged that they could try those again, and they can find a little joy seeping back into their life. I encourage people to take small steps of involvement just for short periods of time, even if they can only attend something for 15 minutes. That 15 minutes is gold. Let's make sure that we help them to still be engaged and connecting to others. And remember that anxiety is a human feature. It's not a flaw. Most of us get anxious from some time or another, and that's just a generally useful emotion that helps us to look at potential threats, figure out what we need to do, and keep us alert so that we're not deceived by others and we get through challenges with competence and capability. Sometimes people get into patterns of coping with anxiety that cause it to snowball. So just recognize your own habits. Maybe pick a tool from today's workshop and think about taking some steps towards managing that a little bit better. And please seek professional help if you recognize that you've got symptoms that are feeling a little bit out of balance or out of control right now, taking over your ability to enjoy life. This is the bibliography of some of the things that I pulled from for today's content. And I think we're out of time. If I went over, I apologize, or maybe we've got about 4 or 5 more minutes. Brenda, how are we doing on time?
We got till 10:40.
Okay, great. So any comments, questions, suggestions, concerns? Is there one thing that you're going to do that you're going to take away from today? One thing. Yes, I'm seeing a yes. Anybody care to share? What's something that you find useful? And maybe you have your own tips that I didn't share today. Anybody?
Deep breathing exercises and those help a lot.
Beautiful. Thank you, Laura. I appreciate that. Others,
Yeah,
go ahead.
somebody asked if you were going to share the PowerPoint.
I am happy to share the PowerPoint. I will get that to Rebecca and then she can distribute it. Yes, absolutely. Any other questions, comments, hot tips for the rest of the group? Things that work well for you. Now comes all the social anxiety. Oh no, she's calling on me.
I think the toolbox was very helpful, I think, to share with clients that some of those things I've thought of, but some of them I haven't. So I think that'll be helpful.
Beautiful. And you can put bling on it, right? Make it something that you look forward to opening, that it's not a sign of, uh-oh, here's my anxiety box, right? It's like, oh, yay, I get to pull that open and pull something out of there. Well, I thank you for all the kind comments here. And I just thank you for showing up today, right? Sometimes that's the one thing that we did. We showed up. And to know that we did that can also build that resiliency zone. I hope that your okay zone gets wider every day as you practice these techniques. And I'm here to just say that it can get better. It can be manageable. So take away a little piece of hope, knowing that if I practice some of this stuff, I might actually feel better and start to allow that joy to become more predominant in my life again. So thank you, everyone. I wish you well. Brenda, do you have the link in the chat or whatever they need to do for their
I did put it in the chat. It's kind of right after everybody introduced themselves. It was like 15 minutes ago. I put it in there.
Okay.
As everyone can see it. And then, yeah, I did it give you an option to save that when you started recording?
Oh, I'm going to pause it and stop it now.